A new report suggests that more needs to be done to encourage safe sex among Canadian youths. Let's Stop AIDS released the results of its annual national survey of over 1,000 Canadians aged 18 to 24. A quarter of participants said they use condoms all the time, while 1 in 5 said they'd never used the contraceptive at all. The organization's founder and president says that sex education in schools is outdated and has even become a political battleground in the country, while healthcare providers aren't discussing HIV testing with young patients. Founder and president of Let's Stop AIDS, Shamin Mohamen Jr., joined us earlier to discuss the report.
This is Let's Stop AIDS' third edition of the Sex Lives Report, and we're grateful to be Canada's largest youth HIV charity, featuring and giving this spotlight. I think this report this year, though, really has always focused around on youth sexual behaviors, but the results that came through were a bit alarming, but not shocking. I think one of the key things that came across was that young people are using less condoms. They're using less protection. The percentage of condom use has been dropping year after year, and we've been tracking it back as early as 2022. There's a clear and consistent trend in Canada, and on top of that, 7 out of 10 young Canadians said they've never been tested for STIs or HIV. And another really worrying part about that is that those that did get tested is that 34% of those youth who were diagnosed with STI or HIV didn't seek treatment. So in Canada, our sexual health education is largely decided by our provinces. The provinces set sort of the tone, the rules, the expectations relating to sexual health. One thing that I really want to be clear is that our sex education isn't giving young people the information they find relevant. It's often not engaging, and it tends to rely heavily on fear. The fear of getting pregnant, the fear of getting infected. But fear only creates barriers. It actually shuts down open conversations that make it harder to develop healthy relationships around sex, which is a natural part of life. In Canada, in our Canadian provinces, we're actually seeing a backlash against sexual education. And it's really, really worrying because a lot of parents are uncomfortable discussing these topics. So young people are often turning to pornography to learn about sex, which is really concerning. Porn portrays sex in a way that's unrealistic, often violent. A lot of misinformation on social media about sexual education. And then, most importantly, as I just said, we have the internet where young people can easily come across misinformation, even outright fake or deep fake news about sex and condoms. And if we want young people to be able to discuss condoms with their partners, we need to be able to empower young people with reliable and accurate information. And we need to understand that there's consequences with these decisions when young people do not feel confident to pick up. That's why here at Let's Stop AIDS, we've been advocating effectively consistently that there needs to be a reform on sexual education here in our country because it'll lead to a deeper and deeper issue. And how's that going to happen? It's going to be it has to be a coordinated effort. Government, schools, civil societies, families, even religious groups all need to work together to understand and ensure that young people are receiving the right information that support to make informed, healthy decisions. We have learned time and time again that people living with HIV simply want the openness and encouragement of questions to come from medical professionals themselves. We have heard the stigma that goes on when a young person comes out from a night out drinking and something happens, or they're coming out in the morning and something. There's the eye rolling, there's the lack of priority of triaging. These are actually not permitted in our system with how we're set up, but these are real things that happen in our country. Now, more importantly, I think one part to highlight is that our healthcare providers need to be the ones to create that space where they're like, do you know if you want to discuss these things, you can ask me any questions. Simply saying that line actually gives young people an opportunity to bring up discussions. At Let's Stop AIDS, we actually host workshops mostly in Ontario and Saskatchewan. This year alone, we've done 95 school workshops. These aren't your boring workshops. They're highly gamified, where we're actually playing, using knowledge, using different forms of skills to actually teach about HIV. At the start of every workshop, we actually ask about their HIV knowledge and what they know. Only 31% said they knew anything about HIV and how to prevent it. By the end of that workshop, it went to 72%.